6 out of 10 Americans who believe their mental health is poor to fair say they don't have access to the care they need. I used an opportunity I had with our leadership team where we were talking about our upcoming national sales meeting. The entire meeting was surrounding around this theme of unleashing your potential, a journey of transformation. And in these discussions, we talked about you can't expect an organization to transform if the employees themselves are not thriving and they're not well physically and mentally and emotionally. And so we had a doctor come in as the keynote speaker to talk about mental health, specifically burnout, stress management, resilience management. And so energized by that conversation I had with my leadership team, I went home and I talked to my family. I started sharing with them my own battle with anxiety and burnout and how Koch was helping us from an employee health perspective and really leaning into the topic of mental health well-being and normalizing mental health conversations. About a week later, one of my family members came to me for the first time in their entire life to share that they had been struggling with depression, anxiety, and were currently struggling with suicidal ideations. In that moment, I just tried to be compassionate and listen and provide this open space, free of judgment, for them to talk for the first time about their struggle. And while this loved one was in treatment, I reached out to Spring Health for help. I wanted to understand how can I best support this individual through their journey. And not only did my family and I get a Spring Health advocate to help us through the events to come, but they also helped us secure access to on-demand resources, to 8 free sessions for each family member to see a therapist. I can't help but think, what if I didn't start the conversation? I'm so grateful that I did. And I am beyond thankful for the support that I received from the team at Spring Health and my entire team at Georgia Pacific.
It's okay to be vulnerable sometimes, and I feel like the stigma is being broken, and I feel like that's connection at work. That makes you motivated, and I would encourage everyone to be a little bit more vulnerable when you have to be.
When we talk about mental health, change does come from the ground up. You know, as supervisors, we're being authentic, we're checking in with our people, we're making it a priority. If we are going to be passionate about our work, if we are going to create the most value, we actually have to be in good health ourselves.